Here we'll discuss all the important points of lead poisoning by the mnemonic chronic lead poisoning. So the C in the chronic, it stands for colic, constipation, chelating agents which is given as a treatment, cattle poisoning, cognition impairment and coproporphyrin release in the urine. Coming to the colic, it is also known as lead colic, where you can see this pain severe in the night. So the person will be having this episodes of pain where he will be unable to eat anything, which causes loss of appetite and the weight reduction. So there will be severe pain in the night. Coming to the constipation, again in case of chronic lead poisoning, the symptoms you will see is constipation. It is important to remember constipation. In the acute poisoning, you can see diarrhea. In the chronic lead poisoning, you will see constipation. And for the treatment of this lead poisoning, we'll give BAL or dipenzylamide or DMSA, all these chelating agents, right? So the chelating agents are given for the treatment of this lead poisoning. It can also be used as a cattle poisoning, and it can cause cognition impairment in case of encephalopathy. Coproporphyrin 3 is released in the urine because of the impaired heme synthesis. So these are the different points you have to remember with C. So first is colic, severe pain in the night, constipation, chelating agents given as a treatment like BAL and DMSA, cattle poison, cognition impairment, encephalopathy. Coproporphyrin 3 is released in the urine because of impaired heme synthesis. Now coming to the lead. So the L in lead stands for lines. Here you have to remember two lines. The first is Burtonian lines. It is a clinical finding where you can see this blue lines at the junction of the teeth, right? So these are the Burtonian lines. And the second is radio opaque metaphyseal lines. These are seen on the X-rays of the bone in the metaphyseal region. So you can see this radio opaque metaphyseal lines also. It is an X-ray finding. And the E stands for encephalopathy, where you can see hallucinations, visual disturbances and delirium, coma, death, right? And in the A, it stands for anemia, which is microcytic hypochromic anemia, which can cause facial pallor. And also all this mechanism is because of inhibition of ALA dehydrogenase and ferrochelatase. And it will also induce abortion as it crosses the placenta, right? So the other points related to anemia, it is because of the decrease in the heme synthesis, and also basophilic stripling can also be seen along with the anemia in the RBC, right? And the T stands for drop, where the wrist drop and foot drop can be noticed. It is seen in the lead palsy. So it is because of the degeneration of the nerves and the atrophy of the muscles, right? So because of the degeneration of nerves, you can see the wrist drop or the foot drop. So the D stands for drop, A stands for anemia, abortion, inhibition of ALA dehydrogenase, E stands for encephalopathy, L stands for two lines. One is a Burtonian line and second is a radio opaque metaphyseal lines, right? Coming to the poisoning. The P in the poisoning, it stands for pallor. So it is the earliest and the most consistent sign seen in case of chronic lead poisoning, right? It is because of the anemia. The second is a lead palsy. Again in the lead palsy, you can see this wrist drop and the foot drop because of the degeneration of the nerves. And the plumbism, this chronic lead poisoning is also called as plumbism. P, paresthesias can be seen. So the mechanism of this lead poisoning is impaired heme synthesis, right? So it will release porphyrins in the blood, urine. Other P stands for the porphyrins. So S stands for sindoor, because this sindoor, which contain lead tetraoxide, can be the source of chronic lead poisoning in the women who wear it. So I have included sindoor also. And the other name of this chronic lead poisoning is satanism, right? So the two names for the chronic lead poisoning is plumbism and the satanism. So the other S stands for satanism. So this is about chronic lead poisoning. C stands for colic, constipation, chelating agents like BAL, DMSA, dipenzylamide, and cattle poison, cognition impairment, coproporphyrin release in the urine. L stands for lines, two lines, one is in the teeth, other is in the bones, Burtonian line, radio opaque, metaphyseal lines. E stands for encephalopathy, where you can see this delirium, visual disturbances, hallucinations, death, the coma and all. And A stands for anemia, because of inhibition of ALA dehydrogenase, ferrochelatase, which leads to the impaired heme synthesis, which decreases the heme. So it causes anemia, which is microcytic hypochromic anemia, and also basophilic stripling can be seen. So A stands for abortion. And D stands for drop, wrist drop, foot drop, lead palsy, degeneration of nerves. P stands for pallor. It is the earliest and the most consistent sign. Palsy again, which causes this foot drop and the wrist drop. Plumbism, paresthesias, porphyrins. S stands for sindoor. It is important to remember sindoor has lead tetraoxide. And other S stands for satanism. So this is about it. Bye.